I'm Maggie, I'm one of Dr. Frisch's PAs. After surgery, we get a lot of questions about what kind of dressings people are going to have and how to take care of those dressings. So most of our patients have what's called a Mepilex dressing. It's like a big waterproof bandage. You can shower with that on, just make sure it's nice and dry when you're done. You're going to take that off at home by yourself 1 week after surgery. Underneath of that, there's going to be just surgical glue over the incision. You can still shower the whole time. You don't need to really wash over the incision. You don't need to put anything on it. No peroxide, no alcohol. You don't need to put any ointments or creams over it. Just make sure it's nice and dry after you shower. So there's really not a lot of care for these incisions. Other people may have something called a Prevena dressing, which is like a miniature wound vac. So it's like a sponge with a sticky saran wrap over the top of it. That's still waterproof. The only part that's not is the pump, and that has to go into a plastic bag in order to take a shower. That'll stay on for 10 to 14 days post-op. People who may have those may be at higher risk for wound complications. If you have some chronic illnesses that would prevent you from healing wounds appropriately, we might throw one of those on. Other people that have revisions might have those on too. There's also a chance that you could have outer sutures, so sutures that would then need to be removed. Most of our patients that have just primary joint replacements done don't have those, but usually if you have a revision done, we'll have sutures on the outside of the knee or the hip, and you will need to have those removed in usually about 3 to 4 weeks after surgery. Another question we get asked often is, usually when you get home from the hospital or from the surgery center, you have a pair of stockings on. They're like compression stockings. A lot of people ask us if they have to wear those. The answer is no, you don't have to wear them. You can take them off as soon as you get home. If you find them comfortable and you want to keep wearing them, you sure can. And a lot of times if you have excessive swelling, we'll suggest that you put them back on. The idea is that they provide compression to the leg, and so they help with some of the swelling after surgery. If you have a knee replacement done, you'll also go home with ACE bandages wrapped around the leg. Those can also be taken off as soon as you get home if you find them uncomfortable. If you find them comfortable and like the compression, you're more than welcome to keep those on as well. Another question we get a lot after surgery is about driving. So it's going to depend, first of all, on which leg you have done. Overall, the answer is that once you are off narcotics for pain control and you feel comfortable slamming on the brakes if you had to, that's when you're allowed to drive. Obviously, if you drive with your right leg and you had the right leg operated on, it's going to take a little longer for that strength to come back so that you can drive and be able to slam on the brakes. So usually when you have the left side done, you can drive usually about 2 to 3 weeks after surgery. Right side is going to be closer to 4 to 6 weeks after surgery before you can drive safely. Another question we get after surgery is, can I do stairs? The answer is yes. So you can do stairs immediately after surgery. The way you're going to do it is you're going to go upstairs with the good leg first, so your non-operative leg, and then bring the operative leg up to it. On the way down, you're going to do the opposite. You're going to go down with the operative leg first and then bring the non-operative leg down to it. So a lot of people come to see us and wonder when it's time to get their joint replaced. The overall answer is that you are having daily pain that is not controlled by our more conservative options, and it's stopping you from doing the things you want to do. So some of the more conservative options would be things like oral anti-inflammatories, injections, physical therapy. If we've tried all of those things and they're not working to relieve your pain, then that's the time that we would consider doing a joint replacement. Sometimes people come to us and they haven't tried these things, but their arthritis is bad enough, or maybe they have a significant deformity that can't be changed by the conservative treatments, and that's when we would consider doing a joint replacement before trying those more conservative options.